Welcome. We're here today with Kara McDavid to talk about the Moose Jaw District Trauma Response Team. Kara is the Community Trauma Response Program Coordinator and also the Mental Health and Addiction Services Senior Social Worker. So welcome,
Thank
Kara,
you.
and
Thanks for having me.
thanks for coming and talking to us about this. So what is it, and who's involved with this team?
Well, the Community Trauma Response Program was sort of born out of the idea that sometimes we do have traumatic or critical events that happen in the community, and we needed to figure out a coordinated way to support people in that, because it's certainly not an easy thing to go through. So the team was born several years ago, and a number of different agencies in the community sit on the committee, including, I probably won't get them all, but including the Moose Jaw Police Service, Bombardier, SIAST, W.J. Jones and Son Funeral Home. A number of different stakeholders in the community came together because they recognized that this was an important service to be able to provide. So,
So what is it that you do, and who would access it?
Well, the Community Trauma Response Program is meant to provide short-term support to people who've been affected by a critical incident. And the way that we define critical incident is any kind of traumatic event. So that could really run the gamut from something like a motor vehicle accident to maybe some kind of maybe a violent death or a suicide, natural disasters, perhaps, a tornado, a plane crash, any kind of event that is traumatic for someone, or where people have a very strong emotional response to. There's a need, or there's a recognized need for people to be able to access short-term support for that. So how do I deal with this? This is something that's very out of the ordinary, and thankfully for that. But when these things do happen, how do people get through it? How do they process these events, and how do they take care of themselves? So that's really what we do as a team, is when an incident occurs, we can be contacted and called out to provide what we call a debrief, which is really a session where people can talk about the experience that they've gone through, and we can provide them with some support and education on how to take care of themselves during that time. Really anyone can contact us if they're needing services. We certainly provide services to people who are directly involved in sort of the day-to-day basis of dealing with these incidents, like first responders and police and EMS. We've also had calls in the past from community members who've experienced some kind of incident who feel like a little bit more support is needed. And then our role is certainly short term, but we also do ensure that people, if they are thinking they need longer term support, can access that. We'll give them the contact numbers to be able to do that.
So somebody doesn't need a referral then?
Oh, no.
So they can just do it on their own?
If someone is interested in accessing the service, or even has some questions about whether this would be appropriate in their case, they can phone the General Inquiries number for the Moose Jaw District EMS office. That's 694-2111. And they can be can provide some information about what's happened and what they're looking for, and then usually they're passed on to me or whoever's available at that time. That's why we use that number, because we know that a quick response is necessary in a lot of these cases. So we like to filter it through a number that's 24 hours a day, then they'll be passed on to someone who will contact them and will help organize an event. So we really will come to them, to the person who's requesting the debrief, and we're okay with doing it in different settings. And we don't want people who aren't sort of directly involved with the incident to attend, but we will provide it to larger groups of people by bringing out more facilitators and what we call peers, which are kind of supports that we use in the process. So anyone can call us if they're interested.
Is it for just for adults, or if a child is involved, will you work with children as well, or any age group?
We will work with children as well, and I think that's something that we kind of assess on a case-by-case basis. So we want to ensure that when we're having a debrief, that the information that we're providing is developmentally appropriate to the children, right? So if we're looking at an incident where there are multiple children involved, we may look at having a debrief for the children where we can present information that would be appropriate for them, perhaps separate from adults. But we really will talk with the person who's requesting the debrief to ensure that the service we're providing will be most helpful to them.
And so where would this service be provided? Would you go into the community, or they have to come in? Or
Yeah, we will provide it in the community. So lots of times it's a lot easier for community members to be able to organize in a place that's familiar for them or that's close to where they live, because we will go outside Moose Jaw to be able to provide the service. So, you know, community centers or fire halls or what have you, we will provide that service. If spacing is an issue, we will support you in trying to find a space that would be adequate to be able to provide the debrief. You really just need a room and a few chairs set up. So.
Yeah. So if somebody's interested in volunteering, what would the process be? What would they need to do, and who could volunteer?
Well, anyone who's interested in becoming a volunteer for the program, we certainly welcome that. And it would be a matter of contacting me at my office, and the phone number for that is 691-2604. And when people start with the community trauma response team, they start as what we would call a peer, which is providing support to people who are already experienced in debriefings and facilitation and who've had some specialized training. So their job becomes a support to the people who are attending, certainly, and also to the facilitator. And so what we do as a team is we have sort of training sessions or skill building sessions periodically where our team gets together and talks about some of the issues that are applicable to us in the work that we do, supporting people through critical incidents, but also practicing the skill set. Because when an incident does occur, we don't want to feel our volunteers to feel, or for us to feel, that we're going in not prepared to be able to do the work, because it's not always easy. You know, certainly dealing with critical incidents can be a difficult process, and we want to provide support to volunteers as much as we can in that. So
yeah. So once they contacted you and talked to you about volunteering, then you would let them know when the training would be available?
I would answer any questions that they had about what that looks like to be a volunteer. And I think it's important for people who are interested in the service to know that our volunteers you know, often are called on a short notice basis, right?
Yes.
So, you know, thankfully we don't have a lot of critical incidents that occur in our community, but we want our response to be quick when they do happen. So people who are interested in volunteering should know that they may get a call and say, well, could you come out tonight? Could you come out tomorrow? And to have the flexibility to be able to do that. And I would certainly let them know about resources that they could access and our training sessions, our skill building sessions.
Okay. So I just want to get the phone number out again. So the phone number, if they feel that they need this service, is
694-2111, which is the Moose Jaw District EMS office, the General Inquiries line. And if they're interested in the program and volunteering, or if they just have some specific questions, they can contact me, which is 691-2604.
Okay. And the EMS number is in the phone book?
It is in the phone book under ambulance.
Okay.
So people can access it then.
Well, thank you.
Yeah, thank you.